That is a complete reconstruction, probably not only of his skin, but probably also a pec release at that point, probably a skin flap from somewhere else on his body. So that's a major, major thing that therapy was able to prevent because we knew what the evidence told us. So things to think about long-term challenges for, and I've got on here for burn survivors, but this is anybody with extensive scars. And these are things that those of you who work in the community may see quite often. One big thing we don't often think about is respiratory endurance. A lot of our burn survivors, about 20%, have associated inhalation injuries. So the damage that happens to the outside of their body, they're breathing in that superheated air, damaging their lungs, impacting their airway. They can months, years, multiple years later, still not have the same respiratory endurance that you would expect them to have. So if you're seeing kids in the school system that have a history of burn, like, why can't they run on the playground? Why can't they do things that their kids their own age are? They haven't recovered their respiratory endurance. I mean, musculoskeletal complications, that kind of speaks to itself. You know, we see HO, we see tendon problems, we see nerve injuries, all of these things that present. You know, burn's kind of one of those things we always talk about, don't look for a zebra if the horse is in the room, right? You're trying to diagnose this. Sometimes with burn, you have to look for the zebra because it does treat every part of your body a little differently. One thing that comes up a lot with burn survivors that you may hear is, like, I get rashes all the time. Like, I'm not doing anything different, but like my body where my burn is not even is like breaking out. Probably one of the biggest things we have to have burn survivors do is change their detergent. They may have used the same detergent their entire life. Their skin sensitivity has changed after their burn injury. We don't really know why, but that's an easy fix. If you hear someone being super sensitive, getting a lot of rashes after a burn injury, have them change their detergent, have them wash their clothes in something else, have them not use the same colognes or perfumes or whatever they may be using. I think decreased coordination, strength, and endurance, I mean, everybody here in this room understands why that happens after a burn. I mean, I think we've kind of talked contractures in circles. You guys kind of understand that now. Garments are great, but garments are also something that they are having to put on, they are having to wear for 2 years of their life after their burn. Compliance can be a huge issue. It's our job to make sure they fit well and fit right, because we need to do everything we can in order to get them to be more compliant. You know, we haven't really touched on anxiety, PTSD, acute stress disorder. All of those things are really prevalent in our burn survivors. We do have resources for pediatric and adult long-term burn care. So if you're working with someone who has a burn, even if they did not come through Children's Hospital, they can still come to our camps, and we'd love to have them. We have trained people who can come in and work with them on a lot of these psychosocial issues. They can be around other people who have walked the same walk that they have. So I would recommend you referring them to our outreach society. Long-term heat and cold intolerance. Imagine somebody who has 70% of their body full thickness burned. That area no longer sweats. They no longer have thermoregulation in that area. What happens in Arkansas in August? It gets really hot, right? These guys are high risk for heat injury, heat stroke. We have to think about those. We have to think about, yeah, I know you want to go fishing. I get that, but let's go at 7 o'clock at night and not at noon. Like, all of those little changes in behavior that you are not thinking about, because what we're thinking about is our skin and our injury, right? We're not thinking about how it impacts the rest of our body. Pain and itching are going to be there, and they may be there for the rest of a burn survivor's life. If we can get these scars better, that does help a lot with itching, but just know that if you have a burn survivor who has itching and has chronic pain, that is pretty common. And there are things that we can do to help with that. Lasers are super effective, so if you're dealing with that, I would recommend you refer them to the burn center because we have other options that can help. And that is the brunt of what I wanted to talk to you guys about. I would just really encourage you to think about some of those scar statistics, think about that elasticity, and put that in context of someone you may be working with who has a scar. We had a great conversation yesterday with our NICU therapist. They have a baby who had a diaphragmatic hernia and has really bad abdominal scars. And the baby can't, when they play like this. And they were problem solving, why doesn't the baby want to reach up? Well, after we talked about this, they said, oh, well, the baby has scars, so they can't reach up. So putting this into other things, our CV therapists that work with kids with open chest, they really think about these concepts. You have somebody who has trauma who maybe had a leg that had to be grafted or has pins or has some sort of injury that required skin to be opened and now they have a scar. How does that impact their movement? So I am answer a lot of emails, answer a lot of phone calls. So if there's anything that I can do to help you guys problem solve any of this, feel free to call me. We are getting ready to start a new study to look at long-term effects of this cutaneokinematics and how we can make it even more simple predictive model. Our ultimate goal for that is to make an app where you guys can take a picture, input exactly where your patient's scars are, and we tell you exactly what to do. Like that. And then we can print a home program, and you can just give it to your patient and say, this is why your scars feel like they do. That is probably 5 years down the road, but if there's anything that I can do for you guys in the meantime, if you want to read into the literature, my ORCID ID is up there, so it links to all of our papers and research. But feel free to email, reach out, or call. Would be happy to help you guys any way I can. If anyone has any questions, we're happy to talk through anything. Yeah. So she's asking what form the neoprene came in. It was actually that's kind of a funny question, because for that case we were just starting to use it and we just published the study, and we didn't really have, now you can buy it in rolls and sheets. At that point I went down to orthotics and stole one off the shelf, and don't listen, Marilyn, my boss is back there, and just cut strips off of, that literally is a neoprene knee sleeve that they ordered and the patient never picked it up. So I just went down and what do we have, what can we use, and it worked. I had a 16-year-old who lost his neoprene, and he went to school and went to one of his teacher's offices, and they had an old school mouse pad. And he took the mouse pad and replaced his neoprene. It worked. Beer koozies, like how many of those do you get at conferences like this where there's just a stack of them? If it's neoprene, it works. One of the things I'm really, really proud about that neoprene study, that was my first research study I ever did, and I had no clue what I was doing. But one of the great outcomes is one of my colleagues in the larger burn community does a lot of outreach in third world areas and areas with less resources, and they have no access to scar management. It's too expensive. It's not affordable. When they went on one of their mission trips, they went to a dive shop and got a dive shop to donate some wetsuits that no one was wearing that were demolished, and they took them down with them. And he had a patient in South America, imagine how hot it is there, that took a dive hood and wore it 23 hours a day over his burn scarred face, and it is beautiful. Like, his scars got so much better. So, things that we do here in Arkansas can impact somebody's life throughout the country. So I think the neoprene is very cool, and it's something everybody has access to. If you guys have ever used a silicone gel sheet, neoprene is about 1/25 the cost. So it is something that even most of our patients can afford. Or we can pick up beer koozies next time you go to a conference. So, yeah. You guys have made it through your day.
Thank you, Mandy. Take care. All right. So y'all ready for my 2-hour lecture? Okay, sorry. Okay, I don't know that I can read all that, but that's your evaluation form. You have until October the 22nd to get all that done. Let's see, SurveyMonkey's there for you. Yeah, if you don't complete the evaluation, you won't get the certificate. So we got to be hard that way. So we have to do it that way. Yes, sir. I think it'll be emailed to you. Is that correct? To my education group. How do they get their certificate? I think it will come via email. If you have any trouble, just contact our program. Okay. You can go to the call center, call me. We'll get it fixed, okay? Yeah. Let's see, and here we go. So we're set up for September. Oh, gosh, we had to tell you, Benton Event Center. So, but yeah, that's where we're going to be headed. So hopefully it's a Friday. Hopefully you can make it. We really want to see you. Y'all been a great audience, lots of great questions. Y'all have any other questions before y'all roll out? Y'all be careful. It's wet out there. And y'all be safe. Take care.